Health, Honorable Mutahi Kagwe. This afternoon, he's joined by the Director General, Nairobi Metropolitan Services, Major General Badi, who is here with us. Is also the Governor of Isiolo, Mheshimiwa Mohamed Kuti, who is representing the Council of Governors and all the governors to demonstrate the nature of this operation that brings the whole of government, both national and county governments, into this campaign. We also have the Director General, Health Services, and other senior officers. True to our word, ladies and gentlemen, we did mention that we are going to give you updates every single day, and today is another day. And therefore, once the Cabinet Secretary is done with the briefing, you'll get an opportunity to ask questions. And please, as you get the opportunity, mention your name and the media house that you represent, and also keep the questions to the scope of today's briefing. And also don't forget to only ask one question so that as many journalists can get the opportunity to ask questions. With those few remarks, I now wish to invite the chair to make the briefing. Fadhili, please.
Thank you. Members of the press, fellow Kenyans, yesterday we announced that there were no new coronavirus cases and that the 7 patients who have tested positive for the virus are still undergoing treatment and are stable. We continue to monitor their progress, as well as the individuals that have come in contact with them. Following successful contact tracing, we are now monitoring an additional 7 people. We have released a total of 44 contacts following expiry of the 14-day period that they are supposed to be isolated. 4 more suspected cases have been admitted at Bagathi Isolation Unit since the last update. And 1 case tested negative and is being processed for discharge. The remaining 3 are waiting laboratory results. We are also following a case in Kilifi County whose tests are also running, and the test will be cleared by tomorrow 7 a.m. Our actions continue to be guided by the trends that we have observed in other countries. Evidence from other countries indicate that the number of infected persons increases dramatically in the 2nd week following confirmation of first case. Consequently, the next 2 weeks are extremely critical for this country as we seek to contain the outbreak. We remain focused, emphasizing high levels of hygiene and maintenance of social distances as the most effective containment measures. These measures require the concerted and committed effort of all of us. Every person must play their part in reducing the risk of transmission through our whole government and our whole society approach. If there is a moment in our country's history where we need to embrace the Harambee spirit, it is today. It is now. Our actions this coming week in particular will determine whether we shall go into a full-blown crisis with grave human economic consequences, or whether we shall limit the adverse impacts of this disease save lives, and reduce the impact to our economy. Balancing the imperative to contain the impact of this disease and the desire to ensure continuity of socio-economic activities without implementing extreme actions, the National Emergency Response Committee, at its meeting today, the 20th of March 2020, has resolved and directed the taking of the following additional precautionary measures. A. All entertainment areas, bars, and other social spaces are to close their doors to the public by 7:30 every day until further notice. Effective Monday, the 23rd of March 2020. During operational hours, all such facilities are to define the maximum number of persons within their premises at any given time, so as to conform to the social distance of 1.5 meters apart. The above facilities are encouraged to introduce, where possible, home delivery services and other innovative mechanisms to support this initiative. I would like to state that eataries, places of food, not bars, places of food, can continue provided that they keep the distances that we have spoken to. But all bars and nightclubs are to close at 7:30 every evening. B. All supermarkets are required to limit the number of shoppers inside the premises at any given time in a manner that conforms to the social distances requirement of 1.5 meters apart. All supermarkets and shopping areas are directed to determine the number of shoppers inside based on the size of their premises. Our queue management system must be established to manage the crowds outside the supermarket, with preference given to the elderly, expectant mothers, and people living with disabilities. Similarly, supermarkets and other shopping areas and no other established of a similar nature are to encourage home delivery services while maintaining high standards of hygiene. All supermarkets and shopping areas must also disinfect their facilities several times a day. This requirement extends to malls and other such like shopping facilities. Where feasible, we encourage supermarkets to open on a 24-hour basis, and upon request, the government will facilitate the provision of the necessary security personnel. This is to ensure that even as you distance, there will be sufficient time to go. Now, while going to those supermarkets, let me again reiterate, it is a person at a time. A person at a time. We do not expect people to go to supermarkets or other social areas bunched together with their children, with their families. Those must be left at home. Shopping should be restricted to one person. Open-air markets, including vegetable, mitumba, and bazaars, are high-risk transmission environments. The management of local markets are directed to ensure that the premises are disinfected regularly to maintain high standards of hygiene. Vegetable markets, in particular, are required to ensure that their goods are displayed on raised platforms and waste and other garbage is collected daily. And I would like at this point to thank those in the chairmen of certain supermarkets, certain markets, open-air markets, who have committed to this cause. And some of them have actually been calling me and telling me that this is what they are going to do. They are doing so at their own cost, and the commitment is highly admirable. Tomorrow, we will embark as a ministry on a major cleanup of fumigation, starting with the Gikomba market tomorrow. As soon as the markets open, there will be nobody there tomorrow because of the prayers, and therefore we will go there in their absence and fumigate everything. D, the county governments, and Dr. Kuti will add to that, are required to prioritize garbage collection and cleanliness of all markets, as well as ensure provision of soap and clean water in all market centers. As far as possible, social distance requirements should be observed. For the avoidance of doubt, markets are to remain open until further advised, provided the directives that we have given are going to be followed, because people have to get places to buy food in any event. E, corporations and businesses have already been encouraged to allow, where possible, employees to work from home. Where employees are in an office, the employer should ensure that social distance requirements are adhered to. Employees may be encouraged to proceed on leave at this time, and employers should actually encourage their employees, those who can, to proceed on leave. We have noted that some companies have yet to comply with this advisory. Indeed, I am told some organizations in the financial sector have specifically asked their employees to continue as usual. They would be held in very bad light in future if anything were to happen in those premises. Your support, as I have indicated earlier, will have significant impact on the trajectory and impact of this disease. To ensure business continuity, that is F, for our manufacturers and industries, factories are required to operate using a minimum workforce, but on a 24-hour shift rotation system, so as to assure compliance with social distancing requirements. This will also help with logistics of public transport of workers, because there will be fewer going to work at any time. Where additional security is required, the government is able to provide the same. To reduce the risk of transmission in our public transport system, we encourage as much as possible that persons stay at home unless on essential business. Public service vehicle operators have already been asked to observe high levels of hygiene during this period. In order to maintain social distance requirements in public service, it is directed as follows: that 14-seater matatus will carry a maximum of 8 passengers. 25-seater vehicles, a maximum of 15 passengers. 30-seater vehicles and above to maintain a 60% maximum of seating capacity. This similarly applies for SGR and commuter train services. And when this happens, it is expected that people will adhere to the directions of the public service transport operators. In other words, there is no point of having 8 people and then 2 people are sitting very close together and leaving the other seats open. The idea is to stay as far away as possible from each other. Public service operators must further clean and disinfect their vehicles at the end of each trip and provide sanitizers for passengers. We welcome the decision by the Kenya Revenue Authority to release seized ethanol for the manufacture of sanitizers that are to be distributed free of charge to the public once production begins. In furtherance of His Excellency, the President, all hospital management in public and private hospitals are to restrict patient visitations to family and relatives of patients who have been expressly contacted by the hospital. Such persons will be allowed access for purposes of facilitating specific requests pertaining to patient care, among them being blood organ donation, payment of bills, discharge of patients, and such necessary activities. We reiterate once again that all travelers coming into the country, now obviously restricted to Kenyans and foreigners with valid resident permits, must self-quarantine for a period of 14 days, failure to which they risk arrest and prosecution under the Public Health Act Cap 242. We wish to specifically reiterate that self-quarantine requirement applies to everybody, including diplomats, international organization staff, and each and every person. And I have said that it would be best if this were observed. As we speak, there is a gentleman we have just picked up in Kilifi because of refusing to self-quarantine, and this is going to continue. And there is no reason for anybody to be embarrassed by being picked up because of refusing to protect themselves and to protect other Kenyans. Remember, when you refuse to self-quarantine, you are exposing the rest of society to the potential of them getting the disease. So when we ask people to self-quarantine, we do so in good faith, but we also do so knowing very well what the impact of contacts with infected persons is. It is irresponsible of anybody required to do so to be walking the streets, going to discos, shopping centers, when you know very well that you can infect other Kenyans. Please, I beg responsibility in this area. As previously communicated, measures on hand washing and hygiene standards are the most effective way to manage the spread of this virus. Finally, ladies and gentlemen, I once again thank all those who have already made individual and collective efforts to sensitize and manage our overall responses to the outbreak. And I want to particularly again reiterate my thanks to the Fourth Estate. These measures may be inconvenient at the moment, and we have no doubt they will inconvenience a lot of people. But I assure you that they are necessary for meeting our indicated objectives of keeping all Kenyans safe. We call for self-discipline and active goodwill in this endeavor. I want to thank you, and before I take on any questions, ask Governor Kuti to just mention about, reiterate the issue of hygiene in counties. Governor Kuti.
Thank you. Good afternoon. I think, number one, I want to start by thanking all Kenyans, because already I am seeing, like in Nairobi, congestions are slowly reducing. But I would like to urge what Waziri has said, that the coming week and the next week are the most critical weeks according to our observation of what is happening to the countries that have been hit by this disease before us. So it is very important not to panic, but also it is very crucial that we become now more vigilant. So number one, the issue of markets, the issue of disinfecting markets. I would like all counties to take this matter very seriously. At the entrance, there should be hand washing and sanitizing where possible, and general cleanness of the markets and the towns in general. The issue is here. Now we are asking Kenyans actually to stay home. That's the message is, please stay home as much as possible. Schools have closed not because of holidays. It's because the kids have to be kept at home. Let them not be gathering in the fields. And the last message is, even as we are seated here, we are not keeping the social distance. We should maintain social distance at every place we go. Thank you very much.
I think, no, are you going to move in or you want umbrellas or what? Sorry? Umbrellas, are there any umbrellas around?
Come on, you can move it.
Na mtazamaji, ni taarifa tu kuhusiana na vipi serikali inavyojitahidi kukabiliana na virusi vya corona. Na waziri wa afya hapo amezungumzia kwamba watu 7 zaidi wamefanyiwa uchunguzi wa virusi vya corona, na kuna wale watu 44 ambao walikuwa wametengwa hospitalini na sasa wameachiliwa, kwa ambao walikuwa wametengwa kwa siku 14 na sasa wameruhusiwa kwenda nyumbani baada ya kupatikana hawana virusi vya corona. Na pia kuna mtu mmoja Kilifi ambaye ametengwa. Inaarifiwa kwamba awali alikuwa amekataa kujitenga kwa siku 14, hivyo basi serikali imechukua hatua hiyo. Na kuna maeneo ambao ya kujivinjari, waziri anasema kwamba biashara kama vile baa zinafaa kufungwa mwendo wa saa 1:30 kunradhi, kuanzia siku ya Jumatatu. Pia kampuni tofauti zinafaa kujitahidi kuhakikisha kwamba wanawasilisha bidhaa muhimu kwa wateja ama nyumbani. Kumbuka kwamba ni hatua ambayo itasaidia kupunguza kuenea kwa virusi vya corona. Pia kampuni kama hizo zinahitajika kuhakikisha kwamba kuna jeli maalum ya kusafisha mikono kabla ya wateja kuingia katika maduka hayo kama vile supermarket. Na mtazamaji, ni baadhi tu ya mambo ambayo yanafaa kuangaziwa wakati huu ambapo virusi hivi tayari vimeripotiwa humu nchini. Pia kuna katika maduka hayo yanafaa kuangaziwa idadi ya watu ambao wanaingia kwa wakati mmoja, isiwe ni watu wengi kwa wakati mmoja, na watu wasijipeleke katika maeneo wakiwa wengi kwa wakati mmoja. Pia mtazamaji, kuna ununuzi mtazamaji, kumbuka kwamba soko la Gikomba hapo kesho litanyunyuziwa dawa ili kuzuia maambukizi hayo. Mtazamaji, tunarejea tu kwa kuendelea kusikiza wanachosema. Naelezwa kwamba bado wanaendelea kutoa taarifa kuhusiana na virusi hivyo vya corona.
And other areas, as I said, the Nyumba Kumi activities have already taken effect and are continuing in the around the country. So we have got a structure that is effective. But I reiterate, the next 2 weeks are really critical for us. If you look at the figures from any country, if you look at the figures from Spain, if you look at the figures from Thailand and elsewhere, you will find that 14 days, about 14 days, from the time you notice the first patient, then there is usually a surge. So we are preparing for it, and we are telling our people, in all honesty, that it is better for us to prepare for the worst. It is better for us to be ready for any eventuality, rather than start getting ready when we know that it has happened. It is better to us to get ready now. And at the Health Ministry, this is exactly what we have been doing, developing our capacity so that in any eventuality, we can at least be able to offer Kenyans all the support that is possible within government. Any questions?
Yes.
Thank you so much. I work for NTV. Of course, we're preparing for the worst, but again, the government seems to be having a soft spot towards entertainment industry, and of course, which contributes to the economy. And of course, we are very keen on protecting the economy, making sure it's going and running. But at what extent? Because at what price? Because we say clearly that, you know, judging by what we've been seeing abroad, and especially China, Italy, a lot is being blamed for the very initial steps not being taken. And I'm talking about a possibility of a complete shutdown, or if you like, lockdown. Of course, you've mentioned the 2 weeks are going to be crucial, but why are we giving entertainment joints some soft spots? If the churches, the mosques, have announced they are shutting their doors, but guys can still congregate at clubs, bars until 7:30 p.m. I think that is also encouraging that, according to my own opinion. That is one. The second question would be, what measures are you going to take when worse comes to worse, and especially for the elderly, for the expectant mothers, and maybe the children and persons with disabilities? Because this one seems to, you know, be a target for this particular virus. So what measures are you going to take? And the last point would be...
Yeah, it's okay now. Somebody else has some. Let's give somebody else a chance.
Swali langu ni kuhusu kujikinga na kujiweka nyumbani. Mimi nafanya rasiku inaitwa kwetu. Hii mambo ya self isolation ni kumaanisha kwamba mtu akae ndani ya nyumba yake, asitoke nje, asitembee nje. Kama unao watoto, ni njia gani ambayo unastahili wewe ambayo una self isolate uwe ndani ya nyumba yako?
Okay, should I? Yes, sometime.
Evangelical churches have said they intend to continue with their services, despite the directive that some churches should actually shut the doors or provide sanitizer. Will the government be moving it possibly just ensure they are adhering to it? And are you considering a sort of flight ban in Kenya? And what is the steps you're cabin crew that are actually coming from the epicenters and are serving people? Are they going on self-quarantine or are they continuing?
Thank you. Let me start backwards and then move forwards. First and foremost, the issue of cabin crew coming from epicenters does not arise. The reason being, there are no flights from Kenya by any airline to epicenters. And that is why we said yesterday, we expressed that there are some people we returned. Because if somebody comes from any country that has got an epicenter, through any means, you know, we return them. And we returned some people on Ethiopian Airlines. We returned some people on Kenya Airways. So we have made it very clear. And the way to protect our cabin crew, the cabin crew are well protected. We are screening them. They also are self-quarantined. When they come in, they stay alone in the hotels. And in fact, the hotels have taken very serious measures. If you have seen some of the areas where these people are, the evangelicals, I was not aware that evangelicals have said that, but I would like to ask them to familiarize themselves with the Public Health Act and see where it takes. But more importantly, you know, it is not really about what somebody has declared here and there. By the end of the day, we have said that this is one situation where the individual is the key. The individual is the key. You know, if a person is telling you, come jump in a hole, and you jump in a hole, surely you will be held responsible for jumping into the hole, not the person telling you to jump into a hole. So let me reiterate, individual responsibility is what is going to count for how we fail or how we succeed in this one. And I would like to reiterate on the issue of the self-isolation. I'll let Dr. Amos explain that again, as he had explained earlier. But I would like to assure you that self-isolation is what is being used in all other parts of the world. Unless individuals require quarantining by force, which we are quite prepared to do. But because of the potential of the kind of numbers that one might have to quarantine, that is why we want to continue encouraging people to self-quarantine themselves. Remember that in 99% of these cases, an individual is not unwell. They are like you and I. It is just like they are positive, but they are not unwell. So really, if you are disciplined, there is no reason for you to be held in quarantine, where you might even we might even be exposing many more other people to you. Secondly, and then on the issue of worst case scenario, as I said, we plan for it. We plan for worst case scenario. We have got different modeling versions of what we are going to do. When this happens, this is what you do. When this happens, this is what you do. And we have the plan of how to take care of the situation. We hope it never gets there. But just like other nations have done, we will do what we can. But by the end of the day, it is important that individuals are also, as the government is preparing itself for the worst, individuals too must prepare themselves for the worst and know, if the worst comes to the worst, what do I as an individual have to do? Because it gets to that. And I said, the worst thing we can do is fabricate stories and say things that are not true. And I want to be brutally honest with Kenyans. I want to be brutally honest and to tell you that we will take every measure that we can, to ensure your safety. But as I repeat again and again, this is a situation where you too must take responsibility. So I want to stop there because I also want to ask General, first of all, Amos will talk about quarantine, and then I'm sure they want to hear something about Nairobi too.
Thank you, CS. Let me start by appreciating the work that has been done by our frontline health care workers, from the ports of entry, at screening, in the isolation units, Mbagathi, KNH, the county health facilities, the emergency operations center, the rapid response teams, for a good job so far. Second, let me also try to explain why week 2 is the most critical week. Week 2 is the most critical week because it takes about 3 to 7 days for you to become symptomatic on average. And when you are symptomatic, that is when you start having that cough, the difficulty in breathing, the shortness of breath, and it is during that time that you have maximal viral shedding and therefore increased risk of transmission. And with the increased risk of transmission, of course, the caseload will increase. In terms of isolation, Self-quarantine requires that when you get home, in the best case scenario, you get home, you go to your room, you lock your room, open the window. Fortunately, the weather in Nairobi has been very, very good, so it's warm at night. You can sleep with your windows open, so long as you have a mosquito net to protect you from the mosquito bites. And then you separate yourself from the rest of your family. Somebody will be able to bring you your provisions, including food. Then you take whatever has been brought to you and ensure that once you do that, you hand them back. Again, limit your movement within the house as much as possible. That is essentially what self-quarantine entails. And it is imperative that we practice this, because even when we talk of the lockdown, the entire shutdown of the entire country, it is basically self-quarantine of the entire population. Thank you, Azil.
Thank you. I want to also add my voice in thanking the people we are working with, the frontline people, the nurses, the doctors. They are working in very difficult circumstances, and we know that they are stretched out. They are stressed out, but we want to urge them to just continue. We have got students from universities. When the university is closed, we want to urge them to continue assisting the hospitals, because as I have said in most of my political life, there are two things that are a calling. One of them is a doctor or a nurse or a clinical officer, and the other one is a teacher. So in this particular case, we are asking our medics to please bear with the situation and continue working. We appreciate each and every moment when you are here with us. Yes? No. Wouldn't you at least want the General to say jambo kwanza? General, please.
Thank you very much, CS Health. Mine is just to reiterate what the CS Health has said. This is a whole government approach in dealing with this health issue. And at a lower level, it is a multi-agency approach to dealing with this health issue, the coronavirus. Of course, you know, cleanliness is a major factor in avoiding every disease that is there. And we have already started cleaning the Nairobi metropolitan, and we are going to continue until we turn Nairobi into a modern city. Mine is to ask all the Nairobi citizens not to throw or not to dump garbage the area we have already collected. The Ministry of Health is going to spray, as you heard from the CS Health, from tomorrow, Gikomba markets and all other markets up to Kenyatta markets and others. And we will be at first to collect all the garbage, ensure that when they come to spray, that area is clean. But we require the help of each and every one of you to ensure that Nairobi is clean. As we embark on this cleaning exercise, I would urge, let us throw the dirt at the designated area, which will be clearly marked now henceforth. So mine is just to urge full cooperation of all Nairobi citizens in order to ensure that our city is clean. Thank you very much.
Thank you all very much.
Thank you all.
Asanteni.
No, imetosha.
I feel I have a burning question, a very burning question. Okay, I'm called Mark Namata from KTN News. One of the very burning questions is about bus fare, especially in Nairobi. How are you going to make sure that that don't overcharge passengers, given that now they will have to carry less? And number two...
moja imetosha. This one.
let me put it this way. We have left that matter under the discussion of the Ministry of Transport and transport operators. But let me say this. We will have an economic challenge, Namasa. There is no question about it. There is not a single organization, there is not a single institution that is not going to be affected economically in this case. And the point is that what we are trying to do is to mitigate it so that instead of a complete and total closure, in which case you get nothing, you at least are attaining some 50%. And if you can continue moving on long, then you can at least get something. It's a mitigating effort. Otherwise, at some point, as you have seen in other countries, you have seen complete and total closure. What we are saying is, at this time, if we can follow this rule, is there a possibility that we must just save it? We must just save our people so that at least they can continue earning a little bit and keep the disease away, rather than complete breakdown and then you earn nothing. So the weighing that we are doing, look at the banks, is the same thing. We have said to them, you know, it is not, you cannot, nobody is going to make the profits that they made last year. It just goes without saying that each one of us is going to take a hit. We are going to take a hit. As an economy, complete economy, we are going to take a hit. As individual businesses, we are going to take a hit. Let's just be reasonable. That's really the issue. All of us, let's be reasonable. If you are a landlord and you see that your people are not coming next month, next 2 months, your people are not paying as regularly, as effectively and efficiently as they should, you have to understand. If you had a mortgage on that building, the bank you had borrowed the money from must also understand that it is not that the people are refusing to pay rent. It is not that the landlord is refusing to pay the mortgage. They just don't have it because of the economic circumstance. And this is where the ongoing discussions headed by the president are about how we are going to mitigate our economy and restart it when we overcome this particular challenge. The most important of them all. We can save the economy, we can save the transport business, but what we must save over and above everything else is Kenyan lives. Thank you very much, ladies and gentlemen.
Thank you so much, gentlemen. See you again tomorrow.
Na mtazamaji, ni taarifa ambao ilikuwa ikitolewa na baadhi tu ya viongozi. Kwanza Waziri wa Afya Mutahi Kagwe akizungumzia tu mambo ambayo yatazingatiwa wakati huu wa mchamko wa virusi vya corona. Mtazamaji ameangazia swala la usafiri akisema kwamba watu wanafaa kuhakikisha kwamba wanasalia nyumbani iwapo hauna jambo muhimu la kufanya. Tulia nyumbani, hakikisha kwamba unajitenga, unazuia kuenda katika maeneo ya watu wengi ili kuzuia kuenea kwa virusi vya corona. Pia amesema uchumi utaathirika kwa hali ya juu, lakini amesema kilicho muhimu sana ni uhai wa kila Mkenya na tujitolee kila Mkenya kuhakikisha kwamba tunadumisha usafi. Na mtazamaji, tunaenda mapumzikoni, nitarejea na taarifa za NTV alasiri.
Now more than ever, you need to be abreast with the daily happenings wherever you are. Get the Daily Nation e-paper with a free COVID-19 newsletter at a special highly discounted rate of Kenya shillings 500 for a period of 1 month. Daily Nation. News anytime, anywhere.
Nyaja wa Kenya. Hii ni public service announcement kuhusu coronavirus.
The Ministry of Health advises all returnees from abroad to self-quarantine for at least 14 days, whether they feel well or unwell.
Wash your hands regularly following the 8 steps of hand washing. Wet hands with warm water, apply a small amount of soap, rub palms together, rub fingers and thumbs and the beads in between, rub nails on palms, rub the back of each hand, rinse with clean running water, and dry thoroughly with a clean dry towel.
Furthermore, it is advisable to cover your mouth and nose adequately when sneezing or coughing and immediately dispose of the tissue in a dustbin. Please do not use handkerchiefs if you can avoid it. If disposable tissue is unavailable, cough into your elbow. Try and avoid close contact with anyone showing signs of respiratory illness, such as coughing or sneezing.
Before you share any coronavirus information on social media, please verify it with Ministry of Health to avoid panic and alarm among your fellow Kenyans.
To achieve great things in life, you must do little things every day, like the 1, 2, 3 with Colgate.
1, wake up, wake up. 2, brush up, brush up. 3, smile through your day with a fresh breath and strong tea. Smile through your day with a fresh breath and strong tea.
Do the 1, 2, 3 with Colgate and give yourself a future to smile about.
Je, maumivu ya kichwa na kukosesha amani? Kaluma Strong hutuliza maumivu ya kichwa, maumivu ya mwili na hata huondoa joto jingi mwilini. Kaluma Strong ina aspirin kama kiungo. Maumivu yakizidi, muone daktari.
Mzungu alikuja hapo kitambo, akapata watu wanachimba gold. Is this a gold mine? Then Muluya akasikia akasema, hii ni kolomani.
Abiri is a solution that gives you the power to book a ticket to your destination at the right time and the right price. Download the app or log on to www.iabiri.com or call us on 0709-215-215 to book your ticket now.
New Blue Band peanut butter. Made with 100% pure peanuts and a good source of omega-6. Grow healthy and happy kids with new Blue Band peanut butter.
This is NTV.
Na hujambo mtazamaji, natumai ubuheri wa afya. Karibu kwenye NTV alasiri. Jina langu ni Nuru Abdul Aziz. Sasa tunaenda moja kwa moja kwa Seth Olale ambaye alikuwa katika kikao hicho ambapo waziri wa afya alikuwa akitoa taarifa kuhusiana na virusi vya corona, na mtueleze tu zaidi ni yapi ambayo yamesemwa. Naam, Seth Olale.
Na Nuru, waziri wa afya Mutahi Kagwe vile vile ametangaza maagizo mapya kuhusu njia ambazo anaamini kuwa ni muhimu katika vita dhidi ya virusi vya corona, na hasa katika sekta mbili, sekta uchukuzi na hasa ile inayozungumzia magari ya umma ya kusafirishia abiria. Na hii leo ama hapo awali waziri Mutahi Kagwe aliweza kutangaza kwamba kuna shughuli muhimu ambazo zitakuwa zinafanyika katika sekta hiyo ya uchukuzi, kwanza kuanzia magari ya kusafirisha abiria ya umma. Hii hapa taarifa yake hapo awali moja kwa moja kupitia runinga ya NTV. In order to maintain social distance requirements in public service, it is directed as follows: that 14-seater matatus will carry a maximum of 8 passengers. 25-seater vehicles, a maximum of 15 passengers. 30-seater vehicles and above to maintain a 60% maximum of seating capacity. This similarly applies for SGR and commuter train services. And when this happens, it is expected that people will adhere to the directions of the public service transport operators. In other words, there is no point of having 8 people and then two people are sitting very close together and leaving the other seats open. The idea is to stay as far away as possible from each other.
Mbali na sekta hiyo ya uchukuzi, waziri wa afya Mutahi Kagwe vilevile ametangaza agizo mpya kwenye sekta ya burudani, hasa katika maeneo ya burudani kama unavyopenda ama unavyopenda kuitaja bars ama vilabu tofauti humu nchini, na hapa taarifa ya Mutahi Kagwe kuhusu agizo hizo.
Balancing the imperative to contain the impact of this disease and the desire to ensure continuity of socio-economic activities without implementing extreme actions, the National Emergency Response Committee, at its meeting today, the 20th of March 2020, has resolved and directed the taking of the following additional precautionary measures. A. All entertainment areas, bars, and other social spaces are to close their doors to the public by 7:30 every day until further notice. Effective Monday, the 23rd of March 2020. During operational hours, all such facilities are to define the maximum number of persons within their premises at any given time, so as to conform to the social distance of 1.5 meters apart.
Una kiu sana kuelekea katika maeneo ya burudani, waweza fanya hivyo chini ya masaa 5 kuanzia sasa, na hiyo ni kulingana na waziri wa afya Mutahi Kagwe. Ametangaza kwamba baa zote ama vilabu vyote vya burudani vitaweza kufungwa saa 1:30 usiku, lakini cha muhimu ni kwamba wizara ya afya imetangaza kwamba wiki 2 zijazo zitakuwa za muhimu humu nchini, kwani wizara hiyo itakuwa inaangazia ama vile kwa virusi vya corona vinavyosambaa humu nchini. Kwa hivyo wizara ya afya inaagiza kila Mkenya kuchukua tahadhari na kujikinga mwenyewe na hasa kusalia nyumbani. Hiyo ndio habari ya moja kwa moja hivi sasa. Nuru Abdulaziz kutoka hapa katika afisi kuu za wizara ya afya. Nuru.
Na shukran sana Seth Olale. Na chama cha wahudumu wa afya umma kinadai kuwa wanachama wake wanalazimika kushiriki vita vya kudhibiti virusi vya corona bila vifaa mwafaka vya kujikinga, jambo ambalo linahatarisha maisha yao. Maafisa hao wa afya wanataka serikali kununua na kusambaza vifaa vya kutosha vya kukinga wahudumu wa afya na vile kutoa mafunzo kwa maafisa wote wa afya nchini ili kuboresha utayarifu, ugunduzi na hatua za kukabili homa ya corona.
So we are asking and we are calling upon the CS. You know, we cannot just bury our hands to the sands. This issue of corona has hit this country. We are telling the CS that the public health officers are the link people between the community and the referral system. So we should make sure that we employ more public health officers, train public health officers. I'm aware there's a training going on for clinicians. We have no problem with training clinicians. We have no training curative aspects. But the public health officers who are the link people between the community level and the level of the referral, they are the most key people.
I've seen tremendous response of all disciplines, and we are calling upon all of us to work hand in hand so that we can come up with a cool solution on this issue. Again, we are calling upon the government to strengthen the people who are coming from outside, so that we don't just allow people coming and we don't know their status. They can be isolated in the airport if they are coming for 14 days. Let us not release them until we find they are safe, so that we can control this issue as soon as possible. Otherwise, we are praying that this issue will leave us the soonest, and we are going to live as usual life. On the issues of pass and those places of enjoyments, right now we don't really want to be in enjoyment. Let us close all of them and remain suspended until we have this issue sorted out. Because those are the places where it's going to add up the transmission of this condition, COVID-19. Otherwise, I have no much. I want to just congratulate my officers in the field. Let us continue. And all factories, we are calling upon them also to employ these public health officers so that they can add up in the wash and facilities and provide.
I'm also supporting the idea of closure of markets and social gatherings. And I'm also appealing to all public health officers and the technicians in this country, because they are empowered by law to enforce all what our leaders are talking about, and it is our mandate to ensure that all whatever is being said is enforced. So I'm appealing to all public health officers to ensure that we are adhering to what the law says.
The frontline health workers, they are the first people to be in contact. If the flights come from China, for example, they are the first to board and they screen them. And so they are the most vulnerable in terms of occupational health and safety. And that is why we said they need to be given maximum protection in terms of personal protective equipment.
Kwa mara ya kwanza waumini wa Kiislamu hawakuhudhuria swala ya Ijumaa kama kawaida katika msikiti wa jamii ya Nairobi. Hii ni baada ya msikiti huo kufungwa kama njia ya kuzuia kuenea kwa virusi vya corona, ikizingatiwa kuwa ni moja ya misikiti mikubwa zaidi Afrika Mashariki, na hivyo waumini wa kitaifa na kimataifa wamekuwa wakijumuika msikitini humo kwa sala. Msikiti umekuwa ukipulizwa dawa kuzuia kuenea kwa virusi hivyo. Hata hivyo, katika baadhi ya misikiti mtaani Isli, waumini wameswali kama kawaida Ijumaa hii, huku wakisisitiza kwamba wanazidi kuliombea taifa na ulimwengu kwa jumla.
Na maradhi kama haya huwa Mwenyezi Mungu ndio anayaondosha. Ikiwa tutaweza kumuogopa Mwenyezi Mungu sana kama vile tunavyoogopa maradhi haya, tutamuogopa Mwenyezi Mungu sana, hakika Mwenyezi Mungu atakuwa ni mwenye kutuondoshea haya maradhi. Haya maradhi Mwenyezi Mungu ndio anaumba na Mwenyezi Mungu ndio anaondosha.
Kwingineko, Dayosisi ya Kanisa Katoliki ya Kisii imetangaza kufutiliwa mbali kwa ibada maalum ya misa ya kuadhimisha miaka 50 tangu kuanzishwa kwa parokia ya Manga. Uamuzi huo umetokana na mchamko wa homa ya corona ambao vilevile umelazimu kanisa kufanya mabadiliko zaidi. Miongoni mwa hatua nyingine ni kuahirishwa kwa sherehe za harusi, kupunguza mikutano ya makundi tofauti ya kanisa na kupiga marufuku tafrija nyingi kwenye mazishi. Akihutubia wanahabari katika kituo cha mafunzo ya dini cha St. Vincent, Askofu Joseph Mairura Okemwa vilevile aliwashauri waumini kutenga mazishi kama hafla za familia pekee. Vilevile waumini watapokea sakramenti kwa mkono badala ya mdomo katika juhudi za kusaidia serikali kupambana na kusambaa kwa virusi vya corona.
We cannot pretend that there is no danger. We advise families to involve their immediate family members who will strictly follow hygiene measures when they meet in funeral places. Those who want to eat can eat somewhere else, but cooking for a large group of people can also be dangerous.
Na mtazamaji, na kwa taarifa hiyo natamatisha NTV alasiri. Shukrani sana kuwa nasi. Kwa taarifa zaidi usikose kutazama NTV jioni na taarifa zetu mwendo wa saa 3 kamili. Naitwa Nuru Abdulaziz. Uwe na jioni njema na uchukue tahadhari, udumishe usafi.